But let's talk about Brad Hazzard, because this bloke got away with a disgraceful lack of leadership, where the Wyong Hospital, which we talked about a lot with its problems with Little Lorelei Bell Chambers towards the end of last year, this is a joint that lots of locals have got problems with. Well, a coal mine wanted to give millions of dollars as a donation to the local hospital. But the woke folk at the hospital turned around and said, no, we don't want this to take place because, you know, coal is evil. It's like kryptonite. Well, I do remember Brad Hazzard going on Ray Hadley's program and saying, well, this is a bad decision and we'll try to look into it. Well, guess what happened? Nothing. Nothing happened at all.
No, more than that, I asked him, what's he doing to overturn the decision?
So let's get to this.
Wallarah 2 coal mine wanted to donate $15 million to Wyong Hospital, which hasn't been going all that great. And Brad Hazzard said, the hospital board has got concerns about air and noise pollution from the project, and we're not interfering to allow the $15 million donation to take place. This is a coal mine approved by the New South Wales government.
Correct.
It's approved by the government, where the health minister won't step in and say we need the $15 million. Now, this is a health budget where they haven't built a new community health centre in southwest Sydney, where I come from, this century, where I've been trying to get the health minister to allocate $2.5 million for a much-needed hearing centre for kids in Campbelltown, and he won't do it. I'm ringing the coal mine to say you couldn't donate the $15 million in the Central Coast. What about helping out in southwest Sydney? I mean, this is just appalling. How can the government approve a project and then say you can't touch their money when clearly they haven't got enough resources to do health properly on the Central Coast or southwest Sydney?
But how also do we not get to a scenario where the minister overrules whatever level of phalanx of bureaucrats? But this always happens. Every health minister ends up getting completely swallowed up by the levels of bureaucracy, doesn't want to rock the boat. Well, fair dinkum, how do you look free money in the mouth with, as you say, a project that isn't just approved but will help fund the state budget that in part will turn around and through royalties pay for the same hospital?
It'll be part of the $2 billion in coal royalties that goes in. They want to give an extra 50. You know, which government knocks back money from a tax-paying company wanting to give more money for public purposes? It's unbelievable, isn't it? Brad Hazzard, hang your head in shame.
Absolutely. Now, look, when we were talking before about sporting